Hello guys, what's up? Good morning everybody. It's your girl again, Veronica. We are here again. A very beautiful day and a very beautiful morning. It's around 10 a.m. here in Africa, Kenya. So we are so much grateful. Please guys, I'm requesting and I keep requesting to subscribe to my YouTube channel. Please guys, just subscribe and you will have helped me a lot. I'm pleading with you people to tell a friend, all your friends to subscribe. And today we don't have much to do. As I told you that my niece had visited me. You know, she's a girl, she's a daughter. Yeah, around 18 years. Yeah. So it's still in the stage of teenage group, and you know, these girls, they have a lot of things in their head, but they are not able to express all they want. They are just curious. They want to know more about themselves, about their friends. You know, in school you can get a friend and this friend will ask you a question. And she knows a hand. A hand is a mom, a hand is a health provider. So maybe auntie can have some the answers to what I have in head. And today I will introduce my guests. Yes, I am introducing my guest. She is my guest today. So she has written a lot of questions here she wants to ask. So I will let her ask me those questions, and I will try to answer them to the best of my knowledge. Actually, I'm going to answer them layman's in a language that she's going to understand. Yes, maybe she will get help from those questions, from the answers. She will help a friend maybe one day, so you don't know what she's going to do with the information she's going to get. And if you hear them ask you questions, please, it's good to listen. This age, they usually like attention. Okay, let me not say attention. If they ask you something, please try and answer. As a parent, as a pastor, as a teacher, you answer to the best of your knowledge in a language that they can understand, I mean. So guys, I will introduce my guest. Welcome. And please, I repeat, just subscribe to my YouTube channel as we continue. Yeah guys. Okay. Yeah guys, as I was telling you, my guests is here. So I'll introduce her. This is Sarah, my niece. Welcome. Good morning.
Morning. Yeah, thank you.
You're good.
For inviting me to this talk.
You're good.
Yeah, I think I might know more during this session. Thank you. Welcome.
You're beautiful.
Oh, thank you.
Yeah, guys. Let's start. Let's hear what this girl has. Yes. Let's go straight to the first question. Ask the first question, baby girl.
The first question I'm going to ask, how do you think one can have a girlfriend or a boyfriend?
Oh my God, guys, you are going to help me in the in the comment section. Am I going to answer as an African mother? As an African mother, they will tell you to wait until you are an adult, my girl. As an African mother, as ideally, me, I usually advocate to have a boyfriend. It's not bad, but it depends what kind of a boyfriend do you want. Do you want a friend? Do you want what kind of a boyfriend are you talking about? Is it
no? Leave aside the friend now, the boyfriend. Something like you might say you are dating.
Okay, now I understand. She's talking about dating. She's not talking about boyfriend. If it's a boyfriend, she can have as many boyfriends as here. But if it's dating, I think dating, you wait until you are an adult. In Kenya, adult is over 18. Are you 18 years?
Yeah. I think I'm old enough to date.
Sarah, do you want to tell your aunt you have a boyfriend and she doesn't know?
Maybe, but I'm not sure if I have one.
Guys, nitachunguza, I will. But anyway, I cannot interfere with her life because she's an adult. But you know, mostly you watch our teenagers between 14 to 18 years, they have indulged themselves in such things. I remember in our time it was hard. It was disaster. If a parent can hear you having a man, not even a boyfriend, a man, you know, will not sleep in that house. But nowadays, we just talk to our teens. You know, they have those friends. Let's say it. They have friends. They are intimate. Yes, you can find even as low as 9 years being intimate. So, parents, teachers, let's guide our children and see. But I will advocate over 18 years. I don't know whether I have answered your question by now.
Yeah, but you say over 18 years, but we'll find someone, a student in Form 3, Form 2, and she's or he is dating. Is there any problem with her?
Okay. That is why I've said that you will find teens being intimate in school as low as 9 years. That's what I've said. So that is why I'm calling upon parents, teachers, pastors, doctors, everybody. We guide our children. So it's not right. They will get unwanted pregnancies. They will get STIs. They don't know. They just want to explore. So it's good we start talking to our children about sexuality as early as possible. Even boys, you talk to your kids about sexuality, about their maturity, about their life as early as possible. Yeah, Sarah, if you are 18, if you have a man, let me see that man. Come with him. Okay.
But he likes taking me out. Is there any problem going out with him?
Oh, this girl is asking about going out with the man. There's no problem.
Wow.
Your man is supposed to treat you well.
Wow, thank you.
Yes, a man is supposed to protect you. When you are over 18 years, you have somebody you are dating. Is this person using me? No. Is this person serious about me? You will know. You will check for the red flags as early as possible, and he should treat you right.
Yeah.
Very well. And don't let that man even to abuse you. Yeah, abusing is a red flag. Sure?
Yeah.
Yeah, you get it. Okay, the other question. This girl has a lot of questions. Oh my God.
Another question is about family planning. Is it good or should it be used by a person who has never had a baby or married? Like me. Can I use it?
This girl wants to use family planning. About family planning, let's talk about family planning. Family planning, Family planning, me personally, I will not advocate for family planning if you don't have a child and if you are not married. Which family are you planning? Which family are you planning? Anyway, on the other side, I can advocate for family planning, an hormonal family planning, which does not have hormones, that is not going to interfere with your hormones. And about family planning, I'll create a topic. I'll create a topic and talk about family planning in general, but I have to answer Sarah. Family planning for a teenager, my friend, me, I will advocate for condom use. Because condom is going to prevent a lot of things. It is going to prevent all the infections. It is going to prevent you from getting unwanted pregnancy. But abstinence is the best. Keep it for your man until you get married. Yes, that is what I will talk. Yeah, I am an African mom. Don't forget. Yes, I will say no. No until you get married. Yes.
I get you about that plan, but like I know. So if I decide to, I'm not supposed to use it at all.
Don't use
Will it bring any infection?
It is not going to bring any infection, but it's going to interfere with your hormones, my dear. In future, you will need your kids. You will need your own babies. Sure. You need your own babies. You want to be a mom as soon as possible. Okay, family planning does not prevent you from getting pregnant, but it can take long for you to get pregnant. You are married, you are there 3 years, you don't have a child. This man is going to kick you away. So why use them? Why? You don't have a family to plan. Don't use them. Yes, I am an African man. Don't abstain anyway.
Okay. Then there is this emergency CG pill. Is it a family planning or what? You know, I don't understand.
Why, guys? This girl has information. This girl has information. Anyway, these people, when they are in school, they talk a lot. I know they have discussed emergency pill, and that one is, I don't know what I'm going to call it, but I'm going to put it in capital letters. Emergency pill is not a family planning method. Stop misusing that drugs. Mostly they usually call it Monday pills, because these girls usually use it every Monday morning. Umeenda kutali yako. Then on Monday you are using the pill. Every Monday. These things are destroying our girls. These things are messing our girls. Emergency pill is not a family planning method. Guys, I will talk about family planning. I will talk about family planning. I will make a topic about that, and you are going to understand more. Sarah, emergency pill is not what? A family planning method. Eh? If it's a must, you use it. In a year, you are supposed to use it 3 times. In a year. Year is 12 months. So you split it in how many months? 4 months. So don't use it every Monday. It is going to mess up. It is going to mess you up. It is going to mess you up. Yes, it's bad. So I will talk about it in another video. So make sure that you watch my videos.
Okay.
Yes.
Another question. How many days should a woman receive her periods?
Okay, she's talking about menses. Menses, you're supposed to receive them like minimum of 2 days, a maximum of 7 days. A maximum of 7 days. So it should not go above 7 days. When it is 8 days and above, it's abnormal. Okay? Yeah.
Talk more about the abnormal bleeding in now.
Yeah, there are abnormal bleedings. I'm not sure that I had made a video on that. But also, I will make another video about abnormal bleeding, because you will find that these girls usually sometimes the hormones are messed up. You receive your periods. You can receive them twice in a month, thrice in a month, or they will go more than 8 days for 2 weeks. It might have been messed up. Those are hormonal changes. There is hormonal changes in your body. So it's supposed to be 2 to 7 days. Maximum 7 days. And if it goes ahead, please go and see a doctor so that you can know about.
So, some of girls, you find them have maybe 2 days. Is it normal?
No, 2 days is normal.
3, 4.
Yeah, those are.
And a week?
Yeah, 7 days. It's normal. Yeah.
Okay. Then the normal color of it.
It should be red. It's clear blood. It's not. It should not have clots. A normal menses should not have clots. Yes, and it should not be false smelling. You know, false smelling blood. It's not false smelling, but you'll find that there is that blood that is smelling very bad. It's not to do that. Normal color is normal blood. If you know blood, it's blood.
So, is it normal to have periods a month?
No.
A whole month?
No. There is something wrong.
So you might have infection or what?
Not infection, there is hormonal imbalance. Hormonal imbalance, I'm going to talk about it. I'll talk about hormonal imbalance and family planning, and that one of bleedings. I'll make a whole video for those, so that people can understand. Because I'm trying my best to answer those questions laymanly, no medical terms. When I talk about hormonal ni vitu ziko kwa mwili za those I don't know what I'm going to call them in there is estrogen, progesterone. I'll talk about them and explain.
Okay. Tell me about vaginal discharge.
Oh my God, this girl is talking about vaginal discharges. In vaginal, okay, simply just know there are those normal vaginal discharges and abnormal ones. If you check on my previous video, there is a video that I have explained very well about vaginal discharges. I've explained well about normal and there is another one about abnormal. So please go and check them. Check those videos. Tell your friend to see that video, and they will understand themselves as girls. And you will understand all the discharges. Actually, I've explained very well, because there are those who are which are normal and those which are not normal.
Okay.
Yeah.
You find a friend of mine is having swellings in her breasts. Then I asked myself, what might be the problem?
Well, you could become a doctor. Why did you not do medicine at least to become a doctor or a nurse? So, because you seems to be very, very, very enlightened about this thing. This girl is asking about breast lump. Okay, these things are disturbing our girls a lot. Okay, it is a swelling in the breast. It's called a breast lump, and it can be either a cyst. A cyst is something that it's filled with water. Around something that is filled with water. Yes. Just a minute. Okay, guys, we are back again. I'm sorry for the interruption. I'm a mother, so my toddler was just around me here, and he wanted some attention, and the other one had woken up, so I had to feed the baby. So we are back. Up to that point, if you are watching and you have not subscribed, please click the subscription button. If you are coming this time as we were continued, please don't forget to subscribe. So continue subscribing as we continue with the discussion. We were talking about breast lump. Sarah had asked about breast lump, and that is where we were talking about a cyst. But first of all, breast lumps, they are two types, Sarah. It can be cancerous, it can be non-cancerous. So mostly it is usually affects the young girls. And those are most non-cancerous. Those for older women, not all of them can be cancerous. Or can be an infection of the breast. So a breast lump, it depends. If you hear something in your breast, please go and see a doctor. Tell your friend to go see a doctor. And guys, it's always good to do breast examination to yourself. Do breast examination for yourself always. It usually prevents, and it is good. Early detection of breast cancer, they are curable. So if you get something that is abnormal on your breast, please see a doctor. Yeah, for good diagnosis, for good treatment, and early treatment. Yeah, Sarah, breast lump, don't joke with it. Go to the hospital. Tell your friend to go to the hospital, and then it will be removed and it will be checked. Guys, I will also create something to do breast examination, to show you how to do breast examination. Yeah.
About cancer. How old can someone get cancer? It's like a kid, can he or she have cancer?
Yeah, you can get cancer. Anybody can get cancer. I don't know which type of cancer you're asking about. Breast cancer. I think Sarah was talking about breast cancer, cervical cancer. Yeah, anybody can get it, and that is why there is a vaccine for young girls. The young girls, they have a HPV vaccine. It is usually good for them to go and take it. It prevents cervical cancer. Breast examination usually also prevents breast cancer from going beyond. When it is detected early, it is curable. Yeah.
And what can cause the breast lump? Does
Okay,
it
the
have
breast lump does not have any cause, but mostly it's because of hormonal imbalance. I was talking about hormonal imbalance. Now, guys, let me tell you a story. We were discussing with my teacher when I was in school, and we had noticed that most of the girls our age, by those time, not this time, now I am an old woman. Those days I was around 20s, and you'll find girls around 18, 19, 20, 20s there. Most of them from college school coming to the hospital with breast lumps. And my teacher it's a doctor there, so he used to remove them. And then he was asking us, What do you think could be causing this breast lump? Because hapo kitambo they were not so much. When he was starting to practice, they were not as many as now. And that is where he was talking about the emergency pill. Then he told us, can you think of emergency pill? They have come. Then breast lump has increased. Anyway, even you think of it, even us, let's think of it. Anyway, the emergency pills they usually interfere with the hormones if they are misused. So, breast lump mostly it's hormonal imbalance. Guys, I am not sure about the emergency pills and the breast bath, but I was thinking loudly with the teacher. Yeah.
I think I have another question about pregnancy. How can you know you are pregnant at the early sign of knowing if you are pregnant?
Sense of pregnancy. This girl, are you pregnant?
I can't.
Are you pregnant?
But it's not bad.
This girl, anyway, you get nausea. Nausea ni kusikia kutapika. As if you want to vomit, there is the vomiting. There is breast tenderness. Breast tenderness ni uchungu kwa matiti. You feel pain on your breast. Those are the early signs. But also when you have hormonal imbalance, you can have those signs. So the best way to know whether you are pregnant ni upima. You test. You go to the hospital, get tested, and you know that you are pregnant. That's all. Because even in pregnancy, your face can start having pimples, but the most early ones, it's no, she's showing me that the blackheads on her face. Okay, she's not pregnant. She's telling me that, but I don't know. She will tell me anyway.
Okay. If you don't want to use condom, and how will you calculating your days to prevent pregnancy?
Whoa, guys, should I teach her or should I wait? Because now, how am I going to teach her school? She's in school. How to calculate her days not to get pregnant? I will show you.
Just teach me, because you can teach me. I teach another one, then maybe I help her to prevent pregnancy.
Guys, there are those safe days. There are those safe days. Safe days, it's when you have intercourse, you cannot get pregnant. But it's a complicated something. So I think these ones need a whole topic on its own. I see Sarah is giving me a lot of content here. So I will teach everybody about safe days. So I will do it after this video. After we are done with this video, I will do the calculation with you guys, and you will see how they are being calculated as I show her. Yeah, that's all. I will show her after this video, all I will. So let's first of all finish all the question, then I will show you.
Okay. My last question. The last one now. Can a girl get pregnant 5 days before period? 5 days before.
That is what I'm going to teach you. I'm going to show you safe days. You need to have a calendar. Okay, those safe days usually teach them using a bead. At the clinics, there are beads. The ones that you count using. You can also use a calendar. Guys, do you have any other question?
I think I remember something. Like, you find a girl had her periods on date 11, but on the next month, the following month, it changes to date maybe 28 or in a date 1 then. What will be the problem?
Sarah is asking about irregular periods, irregularity of period. That is what she's asking about. She's talking about her on the periods date. Periods can be regular or irregular. So to some of us, to some of the girls, and sometimes it's normal. But there is that time that you cannot say it's normal. Okay, some girls can get periods twice a month. Yeah, twice a month. Some girls can get a period on twice a month. This depends on the days. There are cycles on the cycle days. There are cycles which are 21 days. There are cycles which are 28 days. And there are cycles which are 35 days. So those who are 21 days, it will reach somewhere you find that in a month zimekuja mara mbili. You get it? It can be at the beginning of the month, at the end of the month you get again. So those are those which have 21 days. Those who have 28 days, they count exactly at 28. It does not mean that tulipata 11th you get 11th. So where the 28 days is going to end, that is where it can be 1 or plus 2 days. There are those who are for 35 days. Those one can go even a whole month without getting the periods. You understand? Those ones are those which have 35 days. 35 is more than a month. But some other month they can get well. So it depends with the days. And the cycle.
I think I don't have another question. My
Guys,
question are over.
Sarah is so much enlightened. She has just asked me a lot of questions. Others need a whole topic for us to discuss. But I will show her briefly about the safe days, and I will show her in this video so that even you people can understand. Or should I make another video?
Maybe by
Another day so that it can be detailed. Guys, let me promise you that I will make another video on the safe days and it will follow this one. So keep watching my video. Please, as I said, I have one for a video for normal discharges. Go back to my video and see that one, and you'll learn a lot. In this channel we are learning. Despite how much I am doing my day-to-day activities. Actually, this is my activity, day-to-day activity. Now I am a mother, I am a counselor, I'm talking to this girl, and it's like an activity. And you are taking tea as you are talking. So guys, please subscribe to this channel. We are going to learn about our health. We are going to learn, we are going to have fun. We are going to see what we do. We are going to cook. We are going to do everything. So guys, subscribe to this channel and be blessed, and tell a friend to watch it. Guys, thank you very much. Goodbye.